do I have the ability to show the PowerPoint that I sent, or do I have to, or do you do that, Sally? Let me see if I can.
You should do
that.
There
we go.
Yeah.
Yep, got it. Fantastic.
Thanks, Sarah.
Let's put that on. Okay, so I hope you can see that. Brilliant. Okay, I shall fire away then. Well, thank you, Sally, for asking me to talk to your group. I'm very happy to be here. I'm quite sure that the way you are, the image that you have of pushing healthcare forward is absolutely the correct one. And, partly in response to the final question that was put to test, does alternative medicine, does it work? Is it helpful? It's not alternative medicine anymore. What we are doing here is mainstream. It is how patients should be treated, i.e. we have to ask the question why, we have to look for mechanisms, and by doing it that way, then we identify the underlying mechanisms of ill health. So alternative medicine is no longer alternative medicine. It has grasped, as I call it, the intellectual and moral high ground, because we are asking the question, why? What is going on here? So let's get off the theory and onto the practical stuff. That's who I am. I've did 20 years of NHS general practice, then 20 years of independent general practice, and I now work as a naturopathic physician. And the College of Naturopathic Medicine were kind enough to make me their clinical director. And again, it's all about ask the question why. And when you really boil things down to basics, there are two major drivers of pretty much all Western disease, and that's energy delivery mechanisms and inflammation. Now, as some of you may know, my special area of interest are mitochondria. And to use a car analogy, the mitochondria are the engines of our car. And, if the engine of your car doesn't work, then the car isn't going to run. If the engines of our body doesn't work, i.e. the mitochondria, then our body is going to go slow. And so this talk is all about looking after your mitochondria, because this is the starting point to treat all Western disease. It's the starting point to prevent all Western disease. We have to look at energy delivery mechanisms, and we have to look at inflammation. And this is a very quick thing, but this is how mitochondria, are known to be implicated in all these conditions. And so it doesn't matter what the presentation is, the basic workup to treating that problem is the same. It doesn't matter if it's heart disease, eye disease, gut disease, the treatment, the workup is the same. Now, the early stage of mitochondrial failure is characterized by fatigue, and this is now almost universal. When I was in general practice in the 1980s, the TATT, the tired all the time patient, was thought to account for about 40%. Now patients don't come to doctors with that complaint because they know they're useless at treating it. But the subtitle of this book is From the Naked Ape to the Knackered Ape, because most people do not have the energy that they should, and it has much to do with poor mitochondrial function. Late stage mitochondrial failure, i.e. when your mitochondria have been going slow for some decades, will result in all these conditions. Obviously premature aging, but organ failures. So if the immune system doesn't have the energy that it needs to power it, then that will put you at greater risk of cancer. It will put you at greater risk of degenerative disease. If the heart doesn't have the power it needs to power it, you will get heart failure. The brain, I say, weighs just 2% of body weight, but consumes 20% of fuel. If your energy delivery mechanism goes slow, you will develop dementia. And similarly for any other joint, renal failure, hepatic failure, arthritis, gut problems, thyroid failure, all has to do with poor mitochondrial function. So in order to be able to treat our mitochondria, we first have to ask the question, why do mitochondria go slow? What's causing them to run slow? And there are four major players here. The first point, and again, just think of the car analogy. If your car engine goes slow, it might be going slow because you got the wrong fuel in the tank. I've got an old diesel banger out there, which trots along quite nicely. But if I put petrol in it, it doesn't like it. It goes slow. So we have to think about, and the wrong fuel in the tank is all about diet and all about gut function. And if people listening to me today or to us today without talking, if you do nothing other than change your diet to a ketogenic diet, a paleo-ketogenic diet, you will be doing yourself a big favor. And at the center in Zanzibar, which you're setting up, diet is going to be a centrally important part of allowing people to heal. Mitochondria may be going slow because they're deficient in an essential raw material. So again, if your car engine, if it hasn't got a spark, well, it's not spark plugs these days, is it? That shows how old I am. But if your engine doesn't have the essential parts to function, fuel injection, compression chambers, exhaust systems, if that doesn't work, then your engine will go slow. Mitochondria can slow because they are inhibited by something. And that's akin to throwing a handful of sand into your finely tuned car engine. It will block things in unpredictable ways. And the fourth reason why mitochondria may go slow are because the control mechanisms are down. So you could be sitting in a Formula One car with rocket fuel in the engine, but if the thyroid accelerator pedal doesn't function and the adrenal gearbox doesn't work, then you're going to be left on the starting line when everybody else disappears. So this is how I think about mitochondrial function. It's how I talk about this with my patients, and they get that very well. So the single most important thing is the fuel in the tank. If you don't get the fuel in the tank right, all else is going to fail. And this is all about diet. The problem with us modern Westerners is we fuel the body with sugars and carbohydrates, whereas mitochondria function most efficiently on ketones. And in addition to that, sugars and carbohydrates drive inflammation. So, and whenever people ask me a difficult question, I always go back to first principles. I go back to nature and I go back to evolutionary biology. And the fact of the matter is that humans and most mammals, nearly all mammals, evolved eating a paleo-ketogenic diet. And that is the diet that our gut has adapted to function best on, and our whole bodies function on. And I'll talk about what that is in a moment. And secondly, in addition to that paleo-ketogenic diet, we need a basic package of nutritional supplements because modern foods are deficient. And look at this quote. That's from 1936. And believe you me, things have got a lot worse since 1936. So intensive agriculture does not produce good, nourishing food anymore. So what is the paleo-ketogenic diet? Now, this can apply to people living in Western areas, in Eastern areas, to Inuit Indians. Anybody can eat a paleo-ketogenic diet. And the first thing we have to do is make sure we're eating sufficient calories. And many people are overweight. They try to control their weight by eating less, but that actually makes the situation worse. Obesity is not a result of overeating too many calories. It's about eating the wrong foods and having incorrect hormones to maintain weight properly. So the first thing, and many of my patients with chronic fatigue syndrome are fatigued because they're simply not eating enough food. So the paleo-ketogenic diet makes sure that you're eating sufficient calories. People think the paleo-ketogenic diet is a high protein diet. It's not. We have to eat just the right amount of protein. And in the books, I detail how that is, how we can calculate that. It's a high fiber diet because the idea of the PK diet is we fuel our body with ketones, and ketones come from fiber and ketones come from fat. So fiber is an essential fuel for the body, but more than that, it is essential for our gut microbiome. And without a healthy microbiome, everything falls apart. We need a microbiome to generate essential fatty acids, to generate short-chain fatty acids, i.e. ketones, to produce vitamins such as vitamin K, B vitamins, neurotransmitters such as serotonin, but most importantly, it feeds the friendly microbes in the large bowel, which are essential for programming our immune system. And as I mentioned at the beginning, disease is driven by poor energy delivery mechanisms and by inflammation. And if you've got a wrong microbiome, if you've got an abnormal microbiome, then that will put the body into a pro-inflammatory state. So when people say, how much fiber do I need? Well, we're all individual, and you work that out from the Bristol stool chart. And you'll be pleased to hear that you can now get the T-shirt. So here it is, the Bristol stool chart. And essentially, I've missed the numbers off here, but our number 2 should look like number 4's. So it should be a sausage shaped sausage, soft, smooth, with no cracks. And when you're passing a turd like that, you've got the right amount of fiber in your diet. Okay, next we have to think about fats and oils, which are absolutely essential, not just as fuels, but as building materials. And there was a huge debate in the 1970s between John Yudkin, who was the founding professor of the Department of Queen Elizabeth College, and a PhD student called Ansel Keens. And in the debate, Yudkin was saying fat and oil is the most essential food known to man. And Yudkin said, no, it's sugar. And of course, Yudkin was backed by the food industry, the agriculture industry, the Ministry of Defense, and the sugar argument prevailed. And this is why so many of our degenerative diseases date from the 1980s, 1990s, 2000s, and so on, when suddenly carbohydrate has become, the best food to eat. Not so. So fats are very, very important. And the point here, fat has got a very bad name. It's been derided by the medical profession. But in nature, there is no such thing as a bad fat. They are all good fats. And the important thing that you need to know about fats is that you should only ever cook with saturated fats. And by saturated fats, I mean an 8-10 carbon molecule, which is saturated with hydrogen ions. And these are fats like meat fat, goose fat, coconut oil, palm oil, chocolate fat, cocoa fat. These are saturated fats. These are stable, and we should only ever cook with these saturated fats. Now, the point about oils is they're oils because they are unsaturated. They have got a double bond. And so instead of having a nice, stiff, straight molecule, you've got a kink in it. So that is an example of a fat which is kinked at the 3 position. It's an omega-3. That's olive oil. But if it gets kinked at omega-6 and at omega-9, then we get different types of oil, which are essential to our metabolism. But if you heat those fats, if you cook with them, then those safe cis fats, which in nature are all left-handed, will flip to right-handed trans fats. And that is what's so dangerous and so toxic to us. So the key with fats and oils is cook with saturated fats, always cook with lard or coconut fat, and do eat oils, but they must be cold and cold pressed, and then they are completely safe. Okay, carbohydrate, they are an essential part of our diet. And in particular, the 5 carbon sugars, which such as D-ribose, are the raw material to make ATP, which is the energy molecule, DNA and RNA, which are our genetic material, which of course is the fundamental molecules of life. We absolutely must have sugars. And we also use sugar to detoxify. One of the ways that the liver gets rid of toxins is to stick on a sugar group, thereby rendering it water soluble, so that can be excreted from the body. And sugar is essential to do that. But the problem now is we are now saturated with sugar. We have far too much sugars, which also comes from starches like potatoes, wheat, grains, and so on, overwhelms our needs, overwhelms the body's ability to cope with that, and that drives obesity, diabetes, and from diabetes, Alzheimer's disease, which is now being called type 3 diabetes, cancer, because cancer can only feed on sugars, and dementia. So if you want to prevent all those conditions and indeed reverse them, then a low carbohydrate diet is absolutely essential. So the first thing we have to do is to cut out substantially reduce the carbohydrates, get the right amount of protein, eat lots of fat and lots of fiber. And of course, patients love to tell me, oh, I eat this, I eat that, I eat the other, I must be doing it right. But now what I like people to do is to test, to make sure that they are in ketosis. Now, you don't have to be in ketosis all the time, but you should be in ketosis at least once or twice a day, because that tells us that you're not overwhelming your body with sugars and carbohydrates. And I like people to test their ketones. Now, there are three ways we can do this. There are three types of ketone that we see when we start to generate energy through fat burning. There's beta-hydroxybutyric acid. Now, that can be measured in the blood. That is by far and away the most accurate way to see if you're in ketosis, but you have to prick your finger to get some blood, and the testing strips are expensive. And as you probably gathered, I'm mean, I'm a bit wimpy, and I don't like to do that. Acetoacetate excrete in urine, and you can pee on urine sticks, and that gives you a good idea if you're in ketosis. Or my preferred method is to use an inhaler, a breath meter such as that. You just exhale into it. You can get hundreds, of test results from that. And that tells you when you are doing the diet properly. Okay. So having sorted out the diet, we then have to look at the upper fermenting gut. Now, one of the problems of high carbohydrate diets is we overwhelm the ability of the gut to deal with that. Now, the upper gut, by which I mean the stomach, duodenum, jejunum, small intestine, most of the gut is a near sterile, acidic, digesting gut for the business of digesting, absorbing proteins, minerals, fats, and some starches. The lower gut, by which I mean the large bowel, the colon, is full of microbes. It's a fermenting gut, and that's what we call the microbiome, and that is fed by fiber for all the good things that we've talked about. Now, if we overwhelm our stomach's ability to sterilize the upper gut, then foods start to ferment in the upper gut. Sugars and carbohydrates start to ferment there, and that is very bad news. Now, as usual, I have jumped ahead of myself, so forgive me, but these are the problems of the upper fermenting gut. First of all, foods are fermented to toxins, such as ethyl alcohol, propyl alcohol, butyl alcohol. I don't need to read that out because I'm sure you can read. This fermentation is called the auto-brewery syndrome for obvious reasons. And all these toxins have the potential to poison us. So, if I had a glass of wine for breakfast, I would not be functioning now, for obvious reasons. The second problem is that the microbes that build up in the gut, which are bacteria and the fungi, then produce their own toxins. Bacterial endotoxin, fungal mycotoxin, for example. One example of bacterial endotoxin is tetanus. Now, if you got tetanus, it's not the tetanus bacteria that kills you, it's the endotoxin, it's the tetanus toxoid that kills you. So bacterial endotoxins can be very nasty indeed. And these toxins spill over into the portal vein and so to the liver. And the liver has to detoxify the contents of that that's pouring through from the gut. And that takes up a huge amount of energy and, of course, raw materials. So one example of this, as I mentioned earlier, the energy equation. At rest, the brain uses about 20% of the energy. Our hearts consume maybe 7% of the energy, but the liver consumes 27% of all the energy generated in the body for the business of detoxifying. And so many of my patients tell me, once they get on the paleo-ketogenic diet, they immediately have more energy and less foggy brain for the reasons that I've explained here. Gases generated can cause burping, bloating, which can cause symptoms. I don't say that burping is pathognomonic of the upper fermenting gut, but it's absolutely typical of. If you are burping, it's very likely to have upper fermenting gut. But these microbes in the wrong place drive inflammation. Now, I was taught at medical school that, yes, the gut is full of microbes, or rather the lower gut is full of microbes, and there they stay. We now know that that is not the case. We know that these microbes move into the lining of the gut, and that drives inflammation there. And first of all, that causes leaky gut. And if you've got leaky gut, then you cannot concentrate acid in the upper stomach. And acid is an essential part of digestion because We need acid to digest protein. We need acid to absorb minerals. It determines gut emptying, but most importantly, it sterilizes the gut and protects us from infections. Now, remember, 90% of all infections get in through the mouth and the nose. Those that are inhaled get stuck on sticky mucus, and that sticky mucus is coughed up and swallowed. So all these microbes should end up in an acid bath of the stomach. And if you don't have an acid stomach because you are fermenting, then you're going to be at hugely greater risk of any infection, any respiratory infection, any enterovirus, any gut infection. But another problem is that these microbes also leak into the bloodstream. Now, the microbes that are fermenting in the upper gut are not evolutionary correct microbes. The immune system hasn't been looking at these microbes for hundreds of thousands of years. And therefore, if they get into the bloodstream, they will get stuck at distal sites. They'll get stuck in our muscles, in our joints, and there they will drive other pathology. And I'm quite sure that a huge amount of pathology from inflammatory bowel disease, arthritis, fibromyalgia, connective tissue disease, autoimmunity, is all driven by allergy to microbes from the upper fermenting gut. So, and what's the starting point to treat that? Well, stop feeding them sugars and carbohydrates. Eat a paleo ketogenic diet. Allow normal gut function to be restored so that you have an acid stomach, which is I say, defense against disease and essential for digestion. What else? Okay, and then again, the inflamed gut drives the inflamed brain. These two things happen in parallel. Okay, so here's an easy way to self-diagnose. So fermentation of fiber by friendly microbes should take place in the colon, and these gases make you fart. And those gases are hydrogen and methane, and they are odorless. So when the diet is correct, yes, you should fart, but they shouldn't be offensive. If you are fermenting downstream and you are fermenting protein because you have failed to digest it or you have good short gut transit time, then you will produce hydrogen sulfide, and that stinks. So if you're producing smelly farts, then you have got an abnormal microbiome. If you've got inoffensive, then you are doing things correctly. So how do we treat the upper fermenting gut? Because we have to do this before we do anything else. And the first thing is, don't feed them. Starve them out with a low sugar, low carbohydrate diet. So that's normal amounts of protein, high in fat, high in fiber. Normalize digestion, and that will do it. And again, chewing is an essential part of digestion. Mastic gum is excellent for this. So just chewing food properly and spending time eating your meals and chewing stimulates the whole of the gastrointestinal tract. Vitamin C to bowel tolerance, and I like at least 5 grams daily, maybe more, 6 to 8 grams daily, most people end on. So that is 5,000 milligrams. It's much more than the government's risible recommendation of 30 milligrams. Now, the reason that humans have to take such big doses is because it's humans, fruit bats and guinea pigs that cannot synthesize their own vitamin C. So the reason my little dog Nancy, who is my best friend, I have to say, the reason she doesn't need to take vitamin C is because she can synthesize it herself. And dogs can make up to 10,000 milligrams. That's 10 grams daily. Goats can make up to 15 or 20 grams daily. And they do that in response to demand. And the need for vitamin C will greatly increase in response to any infection. And that includes the upper fermenting gut. The upper fermenting gut is an early sort of infection. Those microbes are just waiting to get into our body to drive pathology. So vitamin C by day. And then at night, I like to use iodine. And these are both extremely inexpensive preparations that anybody can access. And I use Lugol's iodine, 15%, 3 drops, which is approximately 50 milligrams at night. Now, the key here is to take iodine away from vitamin C. Vitamin C is an oxidizing agent. Iodine is a reducing agent. So they will knock each other out. And start with low doses and build up slowly. Okay, so now we've got the PK diet in place, and you have dealt with your upper fermenting gut, you're now in a fit state to tackle what I call the mitochondrial engine. Because for your engine to work, it needs obviously the raw materials, as we've seen, freedom from toxic stress, the control mechanisms, and I should have added servicing and repair, which is sleep. Now, I'm going to whiz through the next bit rather quickly, because this describes the research that I did in patients who had chronic fatigue syndrome. So in the 1980s, I was seeing patients who were tired all the time, because I say that's a very common way that people present with disease. And then getting interested in people who have fatigue, I then attracted patients who had pathological fatigue, the fatigue, chronic fatigue syndrome, or as it's called, ME. ME is slightly different. Chronic fatigue is the clinical picture we see where there are poor energy delivery mechanisms. And ME is the clinical picture that we see when there's poor energy delivery mechanisms and inflammation. So I worked very closely with Dr. John McLaren Howard because I wanted a mitochondrial function test. Now, I can ask the difficult questions like that, or that seemed easy at me. John has to work out the difficult tests and the biochemistry of how to work that out. But to cut a long story short, he developed a fantastic test that looked at how efficiently mitochondria generate energy, how well the engines of our car function, how fast they turn over, why they go slow, and how much energy they can generate. And as a result of that testing, we were able to score the mitochondrial function. And we then went on to produce a study in 71 patients who had chronic fatigue syndrome. And these had done the diet. I'd worked them up as best as I could, but they were still stuck. And I assessed the level of fatigue in those patients clinically. I sent the bloods to Acumen Laboratories, who did the study, did the mitochondrial function tests, and scored each patient individually. And then the results were independently assessed by Professor Norman Booth of Mansfield College, Oxford University. And we published it in the Journal of Clinical Experimental in January 2009. That is the abstract. But this is the most important graph that came out of this, which is I scored these patients' ability on the standard scale. So the most fatigued ones on the naught, and the less fatigued higher up. John calculated the mitochondrial energy from his testing. And as you can see, there was a very good relationship between the two. This is the control group of normal people who are otherwise well. And this was the first solid bit of evidence that energy delivery mechanisms are implicated in chronic fatigue syndrome. But to say, not just chronic fatigue syndrome, all other pathology. So we then followed up as many of these patients as we could, and we repeated the studies subsequently, having put in place the necessary regime, which I'm not going to go through in detail, but these are there are 30 patients here. The mitochondrial energy score before is in purple, and after the interventions are in orange. So as you can see, these first 30 patients that we saw who had put the regimes in place all improved their mitochondrial energy scores. This tells us that the regimes are highly effective. There were 4 patients who, for whatever reason, chose not to do the regimes, and in every single case, their mitochondrial energy score worsened. I mean, I know the numbers aren't great, but the statistics are so powerful that what this study tells us is that the interventions, the natural interventions we're doing, are highly effective and improve mitochondrial function reliably well. So these are, so although we cannot do these tests, it doesn't matter, because we now know how to improve mitochondrial function. And if you improve mitochondrial function, this really is the starting point to treat all conditions, from dementia, heart disease and cancer, chronic fatigue syndrome, degenerative disease, the lot. What do we have to do? Keep the mitochondria the correct fuel in the tank, give them the raw material so they can work, reduce the toxic stress, and sort out the control mechanisms. So I'm now assuming you've all done the paleo-ketogenic diet to perfection. I'm an optimist. You've all sorted out your upper fermenting gut with vitamin C and iodine, nice, simple naturopathic interventions. And then the next thing we have to do is we have to give the raw materials that the mitochondria need for their enzyme systems to work. Now, we know this because we've measured it all. As part of the mitochondrial function test, we routinely measure CoQ10, magnesium, vitamin B3, carnitine, and these deficiencies are very common. And in order of priority, these are the most important things to take. Coenzyme Q10, at least 100 milligrams, magnesium 300 milligrams, and magnesium absorption is greatly enhanced by vitamin D. We should all be taking vitamin D 10,000 IU daily. It's very inexpensive, costs a few pence a day, and vitamin D is also an essential anti-inflammatory in the body. And with all these conditions we're talking about that are associated with inflammation, vitamin D is going to be very important. Vitamin B3, well, I'm not going to read these out, you guys can read, but those are the raw materials that mitochondria absolutely need. And there's another reason here why we must do the paleo-ketogenic diet and sort out the upper fermenting gut. Because from an evolutionary perspective, mitochondria are derived from bacteria. And if you have an upper fermenting gut by bacteria and you simply take these supplements, you're just feeding those microbes in the upper fermenting gut and making that whole problem worse. But as just evidence of the power of these supplements, this was a prospective study of 443 men and women aged between 70 and 88. And all they did was they took coenzyme Q10 and selenium. Look at their cardiovascular mortality, massively reduced in those taking CoQ10 and selenium, more than halved. So if you just do one simple thing to help your mitochondria, take coenzyme Q10, you will be doing yourself a big favor. And then we have to look at what's blocking mitochondria. And we know this because John McLaren Howard went on to do translocated protein studies and other such to see what was inhibiting mitochondria. And these are things that come up all the time. Number one is lactic acid. Now, this particularly applies to my patients with chronic fatigue syndrome because they find it very hard to rest because they're pushing themselves all the time. And when you push yourself all the time, you move into anaerobic metabolism and you produce lactic acid, and that further inhibits mitochondrial function. So the importance of pacing your activity and not overdoing things all the time is very important. Products of the fermenting gut, alcohol, D-lactate, hydrogen sulfide, all inhibit mitochondria. Well, we sorted that out already, haven't we? Diamino compounds come up very commonly. That's dyes, which might be hair dyes, dyes in food, drug dyes. You'd be horrified how commonly they appear on mitochondria. And then there are other such toxins here, which you can read. Malondialdehyde, that's as a result of poor antioxidant status, and you're going to improve that with your vitamin C and your vitamin D. Mycotoxins, viral proteins, and immunoglobulins. So the microbes themselves have products which stick onto mitochondria and stop them working efficiently. And so those are the 4 groups of toxin. So avoid them and get rid. And products of the upper fermenting gut, talked about that. Pesticides of volatile organic compounds. And I have to say, probably the nastiest toxin that faces us all today is glyphosate. It's widely used in agriculture and is extremely damaging to us throughout. There has never been a more important time to eat organic food. So if you can grow your own, get an organic box or choose wisely. But glyphosate is now a major problem. Now, we can get rid of these volatile organic compounds with any sort of heating regime. The one I like best, Epsom salt bath. You can buy Epsom salts very cheaply, but any sort of heating regime. So a stay in Zanzibar, sunbathing on the beach, washing off in the ocean, perfect way to detox, because these toxins come out with fats. They move onto the surface of the skin, and then you can wash that off with water, soap, or whatever. So we can easily get rid of volatile organic compounds and pesticides. And I know because I've collected the figures. Toxic metals, a bit more tricky. They're not removed with heating regimes. And then we have to look at any bacterial or fungal driver. Okay. This is the data showing that heating regimes are highly effective. I'm not going to read that because I'm mindful I'm going to run out of time, but do have a look at that. But the point is, we now know these heating regimes are effective for removing pesticides and toxic chemicals. And roughly speaking, 50 such episodes will halve the body load. Chemicals come out exponentially. So, 50, you'll halve it. Another 50 gets 25%. Another 50 gets 12%. You will never get to zero. But that doesn't matter too much because the liver is very good at dealing with the rest. So just get the load down and let the body sort out what remains. And these are other things that we can do to detoxify, much of which we've talked about already. Basic package of supplements. Glutathione is very helpful for getting rid of toxic metals. Vitamin C, we've already talked about. Iodine, ditto. High-fat diet, well, that's what you're going to do when you're paleo-ketogenic. Vitamin B12, that's often very helpful as well. So all these things help to get rid of toxins. So once you've got your mitochondria in a fit state, then we can tackle the control mechanisms. And that's divided into the thyroid accelerator pedal, as I call it, and the adrenal gearbox. And it's so important to get the mitochondria sorted out first, because thyroid hormones and adrenal hormones impact on energy delivery mechanisms through their effect on mitochondria. So if you don't get your mitochondria sorted out first, you end up flogging a dead horse. So we've got to do these things in order. And, as a clinical doctor, when I first started off, of course, I didn't know all this stuff, but I would give people shopping lists of things to do. And guess what? They would cherry pick and do the easy things. I'll just take a few supplements because that's easy. Or, I'll just get my thyroid sorted because that's easy. But you have to do these things in order. You have to get the mitochondria in a fit state to respond. Otherwise, I say you're flogging a dead horse. And the most difficult thing is the paleo-ketogenic diet. So if at the end of this presentation you do nothing other than do the diet, you will be doing yourself a very big favor. So it's very important. The reason we have evolved energy delivery control mechanisms is to match energy delivery to energy demands. And if you think about this from an evolutionary perspective, this is so important, because from an evolutionary perspective, Homo sapiens, nay, all animals in the and birds and that in the world, they cannot afford to waste a drop of energy. And this is why the thyroid and the adrenal function is so important. And we can diagnose thyroid in two ways, through and blood tests are very helpful, but can be misleading. But these are the symptoms that are peculiar to the underactive thyroid. And if people have these symptoms, fluid retention and edema, particularly a puffy face, macroglossia, a large tongue, and you can diagnose if the tongue is edematous. If you look at the side of the tongue in the mirror, so stick your tongue out and look along the side of it. If you can see your teeth indenting against the tongue, then that's typical of tongue edema. If you tend to bite your tongue when you're eating food, that's another typical symptom. You can get obstructive sleep apnea and snoring. That's typical of the underactive thyroid because the tissues are swollen. Voice changes. Very often my underactive patients tell me they've lost their singing voice or they've got a croaky voice. Swollen, puffy legs, especially at the end of the day. Nerve compression syndrome, so carpal tunnel syndrome in the wrist, possibly sciatica in the back, where you get the tissues are swollen and they crush nerves. All these can be due to the underactive thyroid. But a common way this presents is what I call ketogenic hypoglycemia. Now, to do a ketogenic diet, you have to get in fat burning. To fat burn, you need thyroid hormones. If you haven't got the thyroid hormones, then you fat burn with adrenaline instead. So you feel wired but tired. So inability to do the diet easily and comfortably is typical of the underactive thyroid. And of course, inability to lose weight. Sleep disturbance, being an owl. Very often my fatigue syndrome patients, they can't get off to sleep until midnight and they don't wake until late morning or mid-morning, typical of the underactive thyroid. Now I'm very mindful, I've got 1.5 minutes to complete. So I'm going to zoom through these a little bit, but Sally, you're most welcome to send my slides around to anybody. There's no secrets here. These are other signs of poor energy delivery mechanisms, especially the pulse going slow. If your pulse at rest is much less than 70 beats per minute, That points to an underactive thyroid. Tests are useful, but so often misinterpreted. The bare minimum of tests is there just to make sure that you are not and don't have an overactive thyroid, but all diagnosis is hypothesis. So we're going to hypothesize that this patient is underactive, and then we put it to the test. And we put it to the test with natural desiccated thyroid or glandulars such as Metaviv, but there are many on the market. And we start with low doses and we build up very slowly until you get that sweet spot. Tests for the underactive adrenal gland are often helpful, can be easily done with salivary tests. This is called an adrenal stress profile. And here you can see this person's got low levels of cortisol throughout the 24 hours. So that gives us clues to how to treat that. And to treat adrenal fatigue, obviously try to identify the underlying cause, and then we can use adrenal supports to deal with that. So, so this is the conclusion. We have to do it all. We have to do it in the right order. And this is the order of doing it. And you guys can read as well as I can, so I'm not going to read that out. But you must start with a paleo-ketogenic diet. Okay, I've tried to rush through and get that in 40 minutes, 23 seconds, Sally. I hope I've done that in time. So that leaves us a bit of time for any questions. So I'm going to throw it back to you, Sally. I'll stop screen sharing.
Thank you, Sarah. That was really, really informative. Oh, yeah, I remember the title, The Time 80s. And I remember describing myself as like a, hang on, sorry, I'm just starting my video. I remember describing myself as like a car engine that was revving too high. I used to feel like I was revving too high all the time. What was the other symptom? I couldn't even walk across a field at one point. So I recognized all that. So I didn't find out. I realized very quickly I was going to get no answers from the doctor. So I just kind of muddled through, I think, until, you know, I am where I am now, and I feel like I've got more energy than I've ever had. But some interesting things came up. Okay, so did you say that olive oil is not a good fat?
No, well, it's a good fat, but not a good fat to cook with.
Ah, okay.
So, always only ever cook with saturated fats, which are tough molecules that aren't denatured by heat. Olive oil is a lovely fat. I love to use olive oil, but it must be cold pressed, and you must use it cold in French dressing, drizzled over your vegetables. Do not cook with it, because that then turns it into a bad fat, because it flips the omega-3 left-handed, and you know, in nature, all oils are cis oils, they're left-handed, and then it flips them by heating or hydrogenating. So make margarine from them, or you make you hydrogenate to make margarine, or you cook with them. You flip them into a trans fat, and trans fats don't fit our membranes. They don't fit our enzyme systems. It's like throwing a handful of sand into a finely tuned engine. So oils are great. In nature, there's no such thing as a bad oil. So yeah, and obviously if you can get organic, so much the better. But you know, rapeseed oil, olive oil, fish oils, fantastic. Include them in your diet, but do not cook with them.
Okay, and obviously veganism is very popular at the moment. So how does a PK diet work if you're vegan? Can you have a vegan PK diet?
It is possible, and I do have patients who are vegan and eat a paleo-ketogenic diet. The problem with the vegan diet is they're usually high in carbohydrates. And that's the tricky bit. So the vegans can power themselves, that you have to have lots of oils and fats in your diet. I have a fantastic recipe in the cookbook for, which is you just melt 50% cocoa fat and coconut oil in a saucepan, and then grind up lots of things like nuts and seeds and coconut, desiccated coconut. Mix them together, and I put a bit of carob powder in there to flavor it. Mix them together, and it makes a very good kind of firm like a flapjack almost, but it's like a chocolate. Well, it's like a chocolate biscuit, but it's very low carbohydrate. It's very high fiber because I put lots of ground linseed in there, and it's absolutely delicious. So I make a batch of that. So my lunch is invariably vegan because that's what I have for lunch. It's very quick and easy.
It sounds delicious, actually, Sarah. And for people who don't know, what is ketosis?
Okay, ketosis is the metabolic state which arises when you are fueling the body with fat and fiber. Now, the problem is the doctors, because the only thing that doctors know about ketosis is diabetic ketoacidosis, and that's a medical emergency, and and people can die from that. But ketosis, physiological ketosis, is a very desirable state to be in. And I'll just give you an example of the power and the energy that it gives us. Mike Morton is a keto-adapted athlete. Now, athletes, the distance athletes who are running marathons and large distances, they can improve their performance between 5 and 10% simply by doing a ketogenic diet. So instead of fueling their body with carbohydrates, instead of carbohydrate loading before a competition, they fuel their body with fats. And Mike Morton, keto-adapted athlete, holds the world record for the furthest distance run in 24 hours. He ran 172 miles, and he had to drink fluids, obviously, but he didn't need to stop and eat. Nowadays, when you look at the marathon runners, if they don't get a sugar snack, a sugar jelly beans or Mars bar or some sort of sugar during their run, they've run out of energy at about 17 miles. In this country, the athletes describe it as hitting a wall. In America, it's called bonking, but but we call it hitting a wall.
Well, I can see why. You always mention Lugol's iodine. Why Lugol's?
Well, it's the one that's used in medical practices. It's the longest established. It's a mixture of potassium iodide and free iodine. So it's the best absorbed, and it's widely available. It's very inexpensive, and it has wide application. So it's been going since the 18th century. So it's very safe, and it works extremely well.
And we've got lots of questions coming in about diet. So your opinion on legumes, as these are sometimes avoided in PK cookbooks?
Well, on the PK diet, you can eat what you like. It's a question of amount. And if you can eat pulses and still be in ketosis, and I say you don't have to be in ketosis all the time, but at least once a day, I like my patients to be blowing positive on ketones. Now, the reason for that is we do have a mechanism within the liver and within our muscles to deal with a little bit of excessive sugar. It's called glycogen. And I liken this to a sponge. So our liver contains glycogen, and so long as it's not saturated, so long as it's squeezed dry, and we know it's squeezed dry when you're blowing ketones, so long as it's squeezed dry, if you do have a little bit of excess carbohydrate in the meal, the glycogen sponge in the liver will mop up that sugar and stop it getting into the systemic circulation. So the liver glycogen sponge protects us from the malign effects of the sugar rush coming from the gut following a meal. But the important thing is to squeeze that glycogen sponge dry, and we squeeze it dry through exercise, through living, through using our brains or whatever. But the problem now is people are eating all the time, and they're eating carbohydrates all the time. And so that glycogen sponge in our liver and our muscles gets saturated. It can no longer deal with glucose. We start to spike insulin, and insulin brings sugar down by shunting it into fat. So if you're on a carbohydrate-based diet, you will get fat very easily. And it's very difficult to lose weight until you get the insulin down. You get insulin down by eating a low carbohydrate diet. And once you're running in ketones, weight loss is easy, because you've got more energy, so you're using more energy. You're not hungry when you're in ketosis because your blood sugars aren't going up and down. You've got low levels of insulin, and you're burning energy. So anybody who wishes to lose weight, if they just do a paleo-ketogenic diet, sometimes that alone will do the trick. Very often it's associated with an underactive thyroid, and so that needs to be sorted out. And thyroid establishes our basal metabolic rate. And when our basal metabolic rate goes slow, we run cold. So guess what? One of the main symptoms of the underactive thyroid is a low body temperature at rest. Our core temperature should be at least about 37 degrees centigrade. And some people come to me and they're running at 35.5, 35.8, 36, far too cold. Their thyroid is running low. So that's a very good clue. So by the time you've got the diet sorted out, by the time you got up to speed with the thyroid, and you can do that with thyroid glandulars, then weight loss becomes a walk in the park.
Wow, I can't wait to give that a go, Sarah, to be fair. Somebody's asked, should dairy products be eaten with a PK diet?
Okay, dairy products are not evolutionary correct foods. When that question was put to Gordon Lorraine, who is the world expert on paleo diet, aren't dairy products natural? He said, have you ever tried milking a wild bison? So that's the trite answer. But the fact of the matter is, dairy products, and a friend of mine, Dr. David Fried, did an interesting study which he called the cow and the coronary, and this was published in the Lancet. And essentially, the higher he looked at dairy consumption throughout Europe, because countries collect this sort of data, and the higher the dairy consumption in that country, the higher the risk of coronary artery disease. That's the first thing. Secondly, dairy products are growth promoting. They're growth promoting because they're meant for young mammals. If young mammals don't grow very quickly, they get eaten by predators. And those growth promoting factors are a risk factor for cancer. The third point is the proportion of calcium to magnesium in dairy products is very high, 10 parts calcium to 1 part magnesium. That might be essential when you're a growing child, but when you're an adult, our physiological requirements are for 1 part calcium to 1 part magnesium. Now, they're absorbed by the same mechanism. So if you have a lot of dairy products, you will absorb far too much calcium and you will block your magnesium absorption. And that is a major risk factor for osteoporosis. Studying the BMJ, eating dairy products makes osteoporosis worse. And that is also a major risk factor for heart disease, because the heart needs calcium to contract and magnesium to relax. And it's very common to see people who have advanced heart disease to have diastolic dysfunction, i.e. the heart can contract, but it doesn't relax. It's as if the muscles got stiff. And that is magnesium deficiency, and can be hugely improved. Well, first of all, cut out the dairy products. Secondly, vitamin D, 10,000 IU daily. And then, of course, take magnesium supplements. But magnesium is rich in leafy green vegetables.
Thank you, Sarah. And I love this question because it is very human. If we need to take a day off, a cheat day from the diet, what alcoholic beverage is the least destructive and what are the worst foods to avoid?
Well, the point is of course you can take a day off, and I do. I am no paragon of virtue, and I also like my my drink at the weekends. So the probably most dangerous alcohol is beer, because it's high glycemic acid, it's high glycemic index, and it's very high in fructose, and we know that drives uric acid, and we know uric acid is a major risk factor for coronary artery disease and much more. So I personally like a very dry cider. But spirits would be fine, but as long as the stuff you put in the spirits is not too sweet. So it's the fruit juices going in which are so pernicious. My guess is fruit juice is probably more toxic than alcohol. Now, I might be blasphemous, lampooned for saying that, but it's all about the occasion. So have alcohol to enhance the social occasion, and I do. Once a week is absolutely fine. That's not going to cause you any problem at all. And one example of that is Jean Calment, who a French lady who lived to the age of 122. And guess what? She drank a bit of alcohol. She smoked the occasional cigarette. She was a jolly person. She ate well. She was obviously wealthy. She cycled her cycle up until the age of 100. She played the piano. So a little bit of is no problem at all. And perhaps the most important thing is that we should have a jolly, happy life that is satisfying to us. In fact, there's a study published recently, a town in Rosetta in Pennsylvania, where there's virtually no heart disease before the age of 60. And so I thought, well, what are these people doing? Are they eating a Mediterranean diet? What are they doing? Actually, they were drinking a bit, they were smoking a bit, they were eating lots of meat and fat. but they lived in a tribal organization instead of living in families. You know, they had wide social contact, and they were socializing and they were having fun. And I think that being happy, having something that you can love, having a project that you're working towards is just as vital for our good health as all else.
I remember sort of in the 90s, the sort of late 90s, when I started talking to parents with autistic children. Over the following 10 years, mitochondria dysfunction came up a lot. Now, is there a reason that, you know, can it be a sort of precursor to autism? Is it a driver of autism? What's it to do with autism? Okay,
well, autism is complex, as we know. We know that the major thing that switches on in autism is vaccination. That's about the most dangerous thing that you can do for your child, and they're all implicated, not just MMR. But autism is probably an inflammation in the brain, and we know that mitochondria are centrally involved in damping down inflammation. So, you know, it's complex, but yes, mitochondria have an impact. I mean, sometimes you can't tease out all the different threads in an intellectually satisfying way. But what we do know is that by putting these regimes in place, the paleo-ketogenic diet, sorting out the upper fermenting gut, maybe sorting out the microbiome, treating the mitochondria with basic supplements, has profound and detoxifying, because many of these autistic children are poisoned by heavy metals. In fact, I'm going to jump sideways for a second. Study in America asked autistic the parents of autistic children, what was the most useful therapy for your child? And many said metal chelation therapy. Get out the toxic metals. And we know that vaccines have got either mercury in them or aluminium in them, which are extremely toxic to the brain. So it's a complex clinical picture that requires, not a complex answer, but we have the solutions. As a friend of mine says, the cure is in the kitchen. We have, it's diet, it's basic supplements, it's sorting out the gut, and anybody can do this. This is why I've become a naturopathic physician, because I have so many more clinical freedoms to treat people than I do as a conventional doctor, because conventional thinking of medicine is so hidebound, so narrowed by the drug companies and big pharma, who have reduced medicine to simple algorithms of symptom suppressing drug, temporary relief, further complications. They're not thinking causation. So autism is difficult, it's multifactorial, but the same approach that I've detailed today would do much for any autistic child.
So we're nearly out of time. We've got 3 minutes. I've got 2 questions. I don't know where I heard this, but I've heard that cellulite is just another way of storing toxins. Is that right?
Well, that's a very interesting question. And I mentioned Dr. John McLaren Howard recently, and he had a patient who came to see him who said, can you do a fat biopsy? But I want you to do a fat biopsy of my cellulite. And John said, well, what's the point of that? I don't see that. Anyway, he did both. He did normal fat and the cellulite fat. He said, what was so interesting about the cellulite fat is it was grey. Normally, if you do a fat biopsy, the fat biopsy is white. So he then went on to analyze, well, what is it? And it was aluminium. Now, isn't that fascinating? So I tell you what, it was the one thing that stopped my daughters from using aluminium-based deodorants. When they thought that, they might get cellulite if they use these deodorants, they stopped overnight and found something much safer. But, we are saturated with aluminium. As I say, aluminium deodorants, all the old antacids used to be aluminium based. Water, contains aluminium, aluminium foil, it comes into our diet in so many ways, and it's a nasty, toxic metal.
That is something I never did know. So I'm really, really, really excited to find that out. And the last question is, why doesn't your GP know any of this stuff?
Because they are educated by big pharma. And the mantra of big pharma is a patient cured is a customer lost. Yeah. So, and worse than that, if doctors step out of line and don't treat patients with according to the big red book, then they can be reported to the General Medical Council. And this is why I said earlier, I now work as a naturopathic physician, and I have so many more clinical freedoms to say what I really think and really believe. As you may know, Sally, I'm the most investigated doctor in the history of the General Medical Council. No patient has ever complained about me. And a revealing quote from the GMC defense, which I got through a Freedom of Information Act search, was by their QC, Mr. Tom Kark. The problem with the Myhill cases, the problem is that all the patients are better and won't give witness statements against her. The complaints came from other doctors because they didn't understand my use of vitamin C, vitamin B12, thyroid support, iodine, and so on and so forth. And I just got fed up with defending myself. So the current score is Myhill 38, GMC nil, and I now have left the GMC and I'm practicing as a naturopathic physician, and it's much more fun, I can tell you.
Oh, well, we're so grateful, Sarah, and we're so grateful that you didn't give in and that you kept going. And it must have been very difficult at times. I know it was very difficult at times. And it was like a horrible witch hunt, I think. But we are totally in awe of your talk today. So thank you very much for that.
Bless you, my pleasure.
I look forward to seeing you next time I'm in the UK.
Fantastic. Give me a call.
I will. Take care.
Okay. Bye-bye.
Bye, Sarah. So everybody, that was just amazing. I never knew about the cellulite. I knew it was some kind of toxin, but I didn't actually know it was aluminium. So that's really interesting to find that out. We are going to take another 15-minute break before Dr. Sam White. We're going to play another one of Philly J. Lay's podcasts. Philly had her website hacked, and her mailing list was disappeared. So if you were on Philly's mailing list before, or if you would like to be on Philly's mailing list, just go to phillyjlay.com and sign up for the newsletter. And we'll see you in 14 minutes exactly to speak to Sam White. Thank you.